Good morning. Welcome to the weekly COVID-19 media update. I'm Carrie Schutte. I'm the spokesperson for the Shasta County Health and Human Services Agency. I'm going to start with our numbers for today. We have 47 confirmed cases, including one from yesterday. We've done 5,956 negative tests for a total of 6,003 tests. We have 9 Shasta County residents who have been hospitalized throughout the course of this event. We have 1 person in the hospital right now. We've got 7 on isolation, 15 in quarantine. And as a reminder, those are people who have had close contact with a positive patient. And we have had 4 deaths. I'm going to do a quick round of introductions and then we'll ask for updates. I'm just going to go how you are on my screen. So first we have Mark Mitchelson from Shasta Regional Medical Center. We've got Jennifer Andrea from Mountain Valleys. We have Valerie Lakey. We can't see her, but we can hear her today. She is from Mayors. Robert Folden from Mercy. We've got Matt Pontus is our CEO of Shasta County. Donnell Ewart is our Director of the Health and Human Services Agency. Glenn Hayward, we can't see him either, but he is here from the Redding Rancheria. And Karen Ramstrom is invisible today, but she won't be for long. She's in the same room as I am. We're having some technical difficulties with her computer. And then we also have Dean Germano from Shasta Community Health Center. Does anybody besides Karen have an update before we open to media questions? Not so far. Okay. All right. Then I am going to spin my workstation around, and Dr. Ramstrom has all kinds of good things to share with you.
Good morning, everybody. So I think, are we going to show the screen or not quite yet?
Yeah.
Okay. We're going to show the web page because there's so many new guidances that came out last Friday. We thought it would be helpful to actually visualize them. And there were a handful of guidances that came out that are statewide. The majority of them are actually allowed for counties that have variances in place, such as Shasta County. And to let folks know in terms of process, a key change that happened with this release is that the release date is on the guidance document, as well as a recommended implementation date, which is a week from the date of release. And our process in Shasta County is to push the guidance out as quickly as we are aware of it, and to remind people or let people know that if they've actually been doing preparations, because many businesses have either had their own professional organization guidance or what have you, and they may have already had some time to develop plans. And so just looking at the guidance, if they've already done training and have site-specific plans in place, they can implement sooner than that 1 week recommended effective date. In addition, there's a new language on the front of each state guidance that indicates the local indicators that should be monitored before implementation of the guidance. And so we're really, really pleased that those align with our surveillance measures that we have been working on and are planning to begin posting on the Shasta Ready website in a dashboard format that indicates our level of disease transmission across 3 key areas. And so as we release state guidance, we will be also reminding the community and that business or other sector what our disease transmission looks like, so that they can make appropriate decisions for implementing the guidance, and the public is aware about what our data looks like at the time. So am I going to see the Shasta Ready page?
Should be able to. Mark, were you able to make that work? Okay, we can't see it. Okay. Okay, hold on. It's going to take me just a second then.
So what I can do, let me just read off the list of what's new on the page. So statewide, school guidance came out from both the California Department of Public Health and the California Department of Education. There's day camp guidance, campground and RV guidance, and hotels for tourism, as well as casinos and card rooms. So those are all statewide guidances. And then for variance counties, the new guidances include film, TV, and music production, pro sports without audiences. Bars and wineries were added to the existing restaurant guidance. Fitness centers, family entertainment, including movie theaters, that was actually added yesterday, zoos and museums. And then there are recommendations for pools included in some of the other guidance documents, including the guidance for hotels, campgrounds, and fitness centers.
So that's what they have on their screen.
Okay. And so because there's been so many changes, we have updated the green and red opening, not allowed to open graphic on the Shasta Ready website. And so it looks like that's what you're viewing right now. And so you can see the green is getting much more filled in. And so many of those that I just read off fill up a lot of that page now. And so, and the red is getting smaller, which is good. So happy to answer any questions to the best of our ability.
All right, we're ready for media questions.
Well, I don't know if this is like the Emperor has no clothes, but I didn't have any graphics on my screen at all. Is it only me, or did everybody else have those graphics?
I could see it on my phone on Facebook, but no, those of us in these squares were not able to see it. So
okay.
If you go to shastaready.org and then click on Roadmap to Recovery, there's a nice green and red graphic that Mr. Miller created for us that outlines all the things that are open and that are not.
Okay, thank you, Carrie. I hate to make you work, but can you swing it back around to Dr. Ramstrom? Doctor, I had just a couple of questions. As we're seeing kind of this little uptick in cases, 1, 2, whatever every day, what's the threshold where you get worried about the number of cases?
Yeah, so I don't have it in front of me, but we have several indicators that we're using. And those are aggregated across 3 categories. So they have to do with disease transmission, our healthcare system, and our ability to do containment. And so basically, we sort of do a color-coded scoring across those 3 big buckets and have a final level in terms of our disease transmission. It's called the COVID alert level. And that graphic is going to be on our website in the next couple of days. And so there'll be a little bit more description online. So I'd say there's probably about 10 or 11 indicators in total, 3 for disease transmission, 2 for the health systems, and 5 or so for how we're doing in terms of disease containment.
So does it work like as long as we have the capacity to handle the number of cases, we're okay and you're not worried? Does that make sense?
So that's one aspect. So it's disease transmission. And so, sorry, Mike, we're not quite ready to unveil that today. So I don't have all the details with me. Plus, I'm sort of not in my right place today. So to have all my reference documents, but so we will have that on our website. And we just started doing some fine tuning today. We've been looking kind of retrospectively to see how those indicators and their different levels would have looked if we would have applied it back in April, so we can make some adjustments to what those look like to make sure that they're going to be helpful for us. There's some early indicators, including COVID-like illness. So those would be some of the earliest indications of disease transmission that we would see that would occur before we actually have diagnosed cases. And then we have, there is a measure around our case rates and how that's changing over time. And then, as I said, there's information on hospitalizations and ICU capacity. And then the testing rate is captured in terms of testing positivity. So the more testing that you're doing, the idea is that you want to have a lower testing positivity rate. That means that you're testing adequately to be able to capture individuals that don't have symptoms. And so that gives you a taste of what's in there, but we'll have more detail on that on the website in the next couple.
Okay, thank you. I have one more question for you, and then I'll leave you alone. We've had 4 deaths. How do you determine the cause of death? Is it, they died of COVID or they kind of died with COVID? You know what I'm saying?
Yes, and it can be either. There's been guidance actually that's come out for completion of death certificates and vital records along those lines, and it can actually be either. And we've had both situations occur here in Shasta County, and because COVID can be contributing to the death, but it may not be the immediate cause of death, and so either way, it's actually counted as a COVID-associated death.
Dean, I do have a question. It has to do with the testing center at the college. Following the protest marches, there was a recommendation that people should go get tested. I've noticed that I think there has been a net result of a lot of the appointments being taken up. I think we're pushing into next week now, whereas we used to have a day or two before we could get in. Is there, I thought there was a threshold at which when testing got super busy, they would open up another lane or something, the state indicated. Are we close to that, increasing our capacity for that?
So Dean, I think we're getting closer. We had, I think, one day this last week where we actually had, so the maximum per lane is 132 tests per day. We had 133 one day last week. We are meeting or exceeding the threshold that the state's looking at to ensure that we keep our testing site. But I don't think that we've had enough days in a row where we've been closer to that 132 to actually add a lane. But I think that we're getting closer because we're kind of going up over time. And as you're saying, our appointments are further out. So I think that we're getting closer, and the more we can encourage people to go, then the more likely that we'll be able to add that additional lane. I think that we're approaching that.
And we picked up a number of asymptomatic patients. I assume, Carrie confirmed this with me, as a result of the testing center, right? The testing center.
Right. Yep.
And then public health is doing contact tracing around those folks.
Yes, absolutely. Whether they have symptoms or not, we do isolation and then contact tracing to identify close contacts. Then we implement quarantine orders for those individuals. And we recommend testing for them as well.
Thank you.
And I would throw in there as well as pre-op testing. So as we increase our surgeries, we're screening all those patients as well.
And we've had a handful of cases from those pre-op screenings.
Good questions, Dean. You need to come over to our side.
Just helping you out, Mike.
I have a question. Since Vitalant has been doing antibody testing with their blood donations, are those going to be reported if any of them come up positive?
So if those came up positive, they would actually be reported to us, but they are not at this stage alone. They're not considered a case unless, so what we've actually had a handful of those we followed up on, and the individual needs to actually have the PCR testing done for a confirmation of a current case. As far as I know, we haven't had any come through from Vitalant.
I have a question. This is David Benda at the Record Searchlight. I just want to understand the Shasta, is it ready.org? I apologize, but the site, am I to understand that people will be able to, in a few days, go onto that site and monitor how close we're coming to, a threshold where we need to start being concerned, and maybe we need to rethink this reopening policy?
So it's, we're calling it the COVID alert level, and basically it is a strategy being used across other jurisdictions across the nation that's tailored to your particular jurisdiction in terms of the measures that you use and the levels that you use, population and those kinds of things. And basically it gives us an idea, and it's a communication tool to the community about what mission and our ability to contain and care for individuals with COVID-19 is at this time in our community. And so we're going to use that as our way to keep the community informed so that the public can make decisions about sectors that they visit. And those different sectors can make decisions about the way that they're operating.
And do you know when that'll be up? What day?
Before the end of the week is our goal.
All right, any other questions? Okay,
Maybe-
well, thank you everyone for being. Oh, sorry,
Terry,
go
can I
ahead.
do a shameless plug? I want to do a shameless plug for Vitalant since it was brought up because, you know, we're at well, level 3. Our blood supply is there's a shortage in Northern California. So if people could, if you want to do something for the greater community, you know, contact Vitalant, schedule, and donate blood because we need that. And we're in our trauma season here in Northern California. So anything the public can do would be appreciated. I'm sure Vitalant would appreciate that.
Yeah, thank you for that, Robert.
This public service message brought to you by Robert Folden of Mercy Medical Center, Reading. Thank you very much for that important message. All right, if nobody else has any other questions, we will wish you a fantastic rest of your afternoon and we will see you again next Wednesday. Thanks, everybody.